Hello everyone, welcome to Connect Radiology podcast. This podcast is specially meant for people who are going to appear in NEET PG 2021. I'm your host Dr. Durga Singh, rank 578 in NEET PG 2020. Though this 578 is not a very good rank to classify myself as a topper, whom will listen generally, but still I want those people to listen to this podcast who are struggling with notes and MCQ practice, and people who have joined one platform and feeling low, seeing the knowledge level of another dear fellow who is doing great with another platform. So this is for you. Now, how to use this podcast? I just want you to sit for just 10 to 20 minutes with a pen and a piece of paper and write down the points that I will share, and then decide which point you want to apply with your studies. As this is an audio, I want you to see a small video of just 2 minutes to clarify how I did these things. The link of the video is given in the description box. So let's start. Starting from making notes. See, just know one thing. Every line told by your teacher in lecture is important. If you attend your lecture after studying any topic in depth, along with the question asked from that topic, then you will realize that even examples given in the lecture casually are asked already or can be a potential question for future. So to make a good note from lecture, of course in your own handwriting, it's important to give your full attention in lecture and write everything possible. Now you have one complete note in your hand. Guys, you have to read this notebook thoroughly after attending your lecture. You can't skip this. But let me tell you one thing, that this note is not complete. You have to work on your notes. You have to do the homework. Now, what's homework? See, after finishing your notebook, you have to give all the tests, be it subject-wise or grand test. And you just don't have to give the test. You have to see the discussion videos also. You have to write the extra points from the video under that particular topic, and that also with a different color pen. This different color pen will help you in recognizing that okay, this question was asked in grand test, so it's must know part. This way your revision will be more rewarding. This concept I have shown in the video properly, so just see that video. Now moving forward, you have to solve MCQs. Catch is, you don't have to bookmark them, because you will be adding them in your notebook, again under that topic only and again in a different color pen. One advice, while making notes, make it spacious so that you can add things into them in future. Also, while solving the questions, those questions which you are able to make correct, please don't leave it there only. Please add the word Q in your notebook against that word which is asked. It will help you in revision. Don't leave MCQs under bookmark section. Believe me, you won't get time at the end to look at them. So don't be lazy. Just add. Next is images. Whatever images already asked in the exam or asked in your grand test or subject-wise test, please add the word pic in front of that topic so that you don't forget to look at those pictures before exam. You can have a picture folder in your phone for that purpose. Next thing that I followed was, I used to make index. You can also make very handy index kind of things for each topic where you write everything about that topic in short. Using this index during revision will speed up your revision. When you are going to bed, you can just flip through this index page and can think what you read in notes about this. When not able to remember, just open your notebook and see. This will definitely improve your visual memory also, which is most important for MCQ exam. I have also shown this concept in my video. What next? What next is you can make use of sticky notes or chart papers on your wall. These will be in front of your eyes every time and you can revise from them. But please write only factual things there, which you tend to forget very easily. Similarly, you can create scanned PDFs of topics from your notebook in your phone that you want to study while on duty. You can record your voice studying any topic and listen to those recordings while you are sitting idle in your wards. I used to do this thing last year during my internship, and that was great idea. Okay. Another thing, you can make WhatsApp group with 1 or 2 friends, or even only you, where you paste the copied text or images from Facebook groups. This will decrease your distractions as you need not open Facebook to read that post again and again. You can watch motivational videos time to time. One thing that I used to do that you may or may not follow, I used to give the grand test or the subject-wise test in cyber cafe. Reason was I lacked discipline. I cannot sit at my laptop screen in my room for continuous 3 hours. Giving tests at cyber cafe gave me the discipline and also made time management easy for me, as I used to finish the test in just 2 hours as I was paying money. But just don't give the test. You also have to do back calculation and analyze your performance, how many silly mistakes you did. Listen to the video solution, write them. After all this, you will be surprised to see that majority of the mistakes you did in the test are already in your notes. Another thing that I want to share is, if you are lacking time and not able to solve MCQs, but your notes are completely organized and it includes everything important for exams, then what you can do is, just after reading every line of notebook, think what examiner can ask from this and how he can integrate this topic with other subjects. Believe me, it will help you to apply what you read in your notebook. I have also described this concept very well in that video. Another important thing is integration. For example, you read the topic of Zenker's diverticulum. Now, how examiner can ask from this topic? So first thing, he can give a clinical scenario with symptoms of regurgitation, aspiration, pneumonia, etc. and then ask you to diagnose, that is from surgery. He can give you symptoms of patient like regurgitation, etc. and show you a skygram and ask the diagnosis, that is from radiology. He can give the same clinical features and ask what is the site of origin of this problem, that is from ENT. Or he can give you the similar symptoms and ask which muscle defect is responsible for this, that is from anatomy. So you need to integrate one topic from all the subjects. You will learn this with practice. At last, one important thing, if you want to succeed, each aspect is very important. But the thing that played most important role in my preparation was respect. Please respect your teachers and believe in the material they provided you. If you don't trust them, you will always be in search of something good and you won't get that. So please respect and add smart work, hard work and revision to this recipe. Okay, this is about my preparation for MCQ exam, and this podcast doesn't cover any strategy on how to complete the syllabus or about revision. So, if you found anything helpful, do apply it in your studies and be the topper. So, thank you.